Hi, Steve Small from IDD Therapy Disc Clinics. I'm here with an AcuSpiner which delivers IDD therapy, non-surgical decompression and segmental mobilization treatment. I'm often asked about what is special about IDD therapy because people will hear me talking about IDD therapy as changing spine care. That raises a few eyebrows when I say that, and occasionally there are people who will attack me or even mock me, which is fine. Now, why do we talk in terms of changing spine care when so many other treatments emerge and come with great fanfare that this is the revolutionary new treatment which is going to change the way we help people with back pain? And many of these treatments come and then they go, and we can all think of different treatments that have come and gone. IDD therapy has been around since the late 1990s. You wouldn't necessarily know it because it was quite very low key, small, and developed from a very low base. It developed from this question of why doesn't traditional traction work and what are the limitations of manual therapy? And that leads to an engineering solution about how do we distract and mobilize targeted spinal segments. With the IDD therapy, it's not just putting people on the machine and for 25 minutes, it's a complete program because obviously there are other things going on, and with the IDD therapy there is manual therapy and of course exercise rehab. Where we are today, there are, this is 2018, there are over 1,000 clinics around the world. We're seeking to coordinate the clinics so that there is a greater awareness of the treatment and a greater understanding. Clinics use evidence-based practice, they use VAS scoring, Oswestry Disability Index, various objective and subjective outcome measures. And we're just trying to get a picture of which patients respond best to the treatment. But what we do know is we talk in terms of 3/4 of patients getting a good to excellent outcome with the IDD therapy. Our goal is to help people avoid injections and surgery. Back pain patients are clogging up GP surgeries, and that on its own suggests that the existing modalities are not enough to deal with chronic back and neck issues. We're particularly interested in disc problems, sciatica, nerve pain, and our goal is to decompress targeted spinal segments. Obviously back pain is complex. This is a tool, but as part of a program of care it enables us to do far more for back pain sufferers than current modalities. So you can expect to see a lot more from IDD therapy as more and more practitioners take it on, get experience with the treatment and see the outcomes. There's always going to be refinements. There are so many variables with back pain that it's very difficult to kind of isolate every variable that there is. But we can control aspects of the IDD because we've got data, it's computer driven, so certain variables are duplicable and measurable in a way which just isn't possible with manual therapy. This isn't the answer to every back pain issue. We're not saying IDD therapy is a cure-all, but for a cohort of patients this is certainly the best solution currently available to give them that chance of resolving their pain. So we talk in terms of changing spine care. We are changing spine care, and you're going to see IDD therapy in a lot more practices and clinics in the UK and around the world. So if you'd like to see IDD therapy, or you're not sure, or if you're watching this and thinking, raising your eyebrow, come to a clinic. Every clinic has got an open door policy. You can come in, try the treatment yourself, and experience what other practices have felt. Thanks very much. My name's Steve Small. Look forward to seeing you soon.